Good morning. This is Bangladesh School Bahrain presenting a video on COVID-19, protecting ourselves and our communities. The purpose of making this video is to increase the awareness of COVID-19 pandemic, to remind the role of each one of us in protecting ourselves, our families and friends, and to update on recent developments, especially in Bahrain, and also to motivate students to participate in an art competition conducted by World Health Organization. So let us begin. What is COVID 19? You all know that COVID 19 is a fast spreading disease caused by coronavirus. Common signs of infections include fever, cough, shortness of breath, and breathing difficulties. Some people have no symptoms at all. In severe cases, infection can cause pneumonia, severe breathing problems, kidney failure, and even death. How COVID 19 spreads? Without proper prevention measures, people can contract COVID 19 from an infected person and infect others. COVID 19 spreads primarily from person to person. How? Droplets released when someone sick sneezes or coughs can land on the mouths or noses of people nearby. Close contact with someone sick, like hugging or shaking hands, can also cause this spread. Now, there are two kinds of transmission possible. One is droplet transmission, and the other one is airborne transmission. In droplet transition, coughs and sneezes can spread droplets of saliva and mucus, which will be taken by another people. In airborne transmission, tiny particles, possibly produced by talking, are suspended in the air for longer and may travel further. So, if the droplets are more than 5 micron size, that may come down and will be there on the surfaces. But if the size of the droplets are less than 5 microns, they will be present in the air. Now, let us see who forms the vulnerable and high risk groups. People aged 60 and over, or people at any age with underlying medical problems such as high blood pressure, heart and lung problems, diabetes, obesity, and cancer are most at risk of developing serious illness. Don't worry, you can help protect friends and family who are at higher risk of severe COVID 19. What you should do? Practice good hand and respiratory hygiene. If you have symptoms like fever or cough, avoid close contact with those at higher risk of severe infection. Be supportive and communicate by phone or messaging. Run errands for those at higher risk and help them stock upon their regular medications, supplies, and non perishable food. Avoid entering their home and keep a distance of at least 1 meter. Postpone social gatherings. Make it virtual or pick up the phone. Now, different steps were taken by different countries when this COVID 19 started spreading. Many of the countries closed their borders, closed the schools, there were partial or complete lockdowns. They started safeguarding health workers who are at risk of infection due to frequent and close contact with diagnosed and undiagnosed COVID 19 patients. And then most of the countries focused on developing potential vaccines for COVID 19. You may remember that The Kingdom of Bahrain started the National Task Force for combating the COVID virus. They temporarily closed all retail stores with availability of only delivery services from 26 March to 9th April. And later, they opened again from 9th April to 23rd April. All these hypermarkets, supermarkets, cold stores, bakeries, banks, etc. They prevented public gathering of more than 5 individuals, and they avoided gathering in public parks, public beaches, etc. Kingdom of Bahrain was the first Arab country to participate in the World Health Organization's Solidarity Trial, aimed at jump-starting research for the establishment of a treatment designed to eradicate COVID-19. The Kingdom of Bahrain opened the Bahrain International Exhibition and Convention Center as a testing center for COVID-19. Now, this is history. It's almost 1 year past now. The current situation is that around 160 plus countries are still in the preclinical stage of developing COVID-19 vaccine, while 22 of the countries have started their trials phase 1, and about 20 countries have started their phase 2, and 14 countries have started phase 3. Only two Arab countries have approved the COVID-19 vaccine. Among them, Bahrain stands second in the world to approve the COVID-19 vaccine, the first being United Arab Emirates. The United Arab Emirates and Bahrain says that this COVID vaccine is 86% effective. And Bahrain started providing free COVID-19 vaccine to all its residents and nationals. Even Bahrain's 17-year-old king, His Majesty Hamad bin Isa Al Khalifa, was vaccinated on Wednesday, 16 December evening, as the state media reported, making him one of the first world leaders to receive a COVID vaccine. Earlier, we needed to register ourselves to get this vaccine. But starting from Friday, 25th December, the Ministry of Health in Bahrain advises those who are wishing to receive the COVID-19 vaccination to head directly to their designated residential health centers daily from 8 a.m. to 6 p.m. without the need to register online to book an appointment in advance. The vaccination is available free of charge to all citizens and residents 18 years and above. Dear students, you are below 18, so you still cannot have the vaccine. Now, some questions arises in your mind. If you already had COVID, do you still need the COVID vaccine? The answer is yes. The protection from vaccine may be of more duration than that you get from the natural infection. Also, there is a chance that people who had mild cases of COVID-19 did not build up a long-lasting immunity. Those people may lose immunity in few months to a year or two. So it is better that you take the COVID vaccine even if you already had COVID and you have recovered from it. Now, another question is that can you stop COVID precautions after vaccination? The answer is no. It will be tempting for people to think they can resume a normal life after they have received the two-dose course of the COVID-19 vaccine. But infectious disease experts warn no. Why? That's because the clinical trials that tested these vaccines for safety and effectiveness focused on whether they could prevent you from getting seriously ill or dying from COVID-19. You could still be infected and you could still be contagious even though you had the vaccine. Don't panic. There are still several ways to protect ourselves and others. What can we do to protect ourselves and others? You have to know the full range of symptoms of COVID 19 that by this time you already have. To remain healthy, regularly wash your hands, practice physical distancing, cover your mouth and nose when coughing and sneezing, and wear a mask when physical distancing is not possible. Stay home and self isolate even if you have minor symptoms such as cough, headache, mild fever until you recover. Ask your parents to call your healthcare provider or a hotline for advice. Keep up to date on latest information from tested sources such as World Health Organization or your local and health authorities. Why is it necessary to get your information from trusted sources only? National and local authorities will have the most up to date information on whether COVID 19 is spreading in your area. They are best placed to advise on what people in your area should be doing to protect themselves. Now, this video is made also with the intention to motivate you all to participate in the art competition for school students conducted by World Health Organization. Now, why are they conducting this competition? They are conducting this competition to increase the awareness of this disease and produce works of art that illustrate the role each of us can play in protecting ourselves, our families, and our friends from being infected with the coronavirus and to know what to do if we become infected. The conditions for entry. Entries must be in the form of a drawing or painting by children aged from 8 to 18 years. Artwork must be submitted on drawing paper, scanned, and sent by email to your respective class teachers. The selected artworks will be then sent to World Health Organization office in Bahrain or to the director of the Department of International Relations, Ministry of Health. The last date for receiving entries is 3rd January 2021. Entries will be judged in the following age groups. Category 1, age 8 and 9. Category 2, age 10 and 11. Category 3, age 13 and 12. Category 4, age 14 and 15. And Category 5, age 16 and 18. Winners will be selected by a panel of judges at the World Health Organization regional office in Cairo, Egypt. World Health Organization cannot return original artworks. World Health Organization reserves the right to use submitted artworks in its information products. Now, the entries must be accompanied by the form attached, which include the full name of the participant, country of residence, that is Bahrain for you, your age, full home address, name and address of the school with telephone contact number. Your class teacher will share that with you. The name of the legal guardian with telephone contact number. It can be your parent, email address of student or parents. And the information must be written legibly, preferably typed, because the form in Word format will be shared with you by your class teachers. Drawings submitted without the required information will not be considered. Winners will receive a prize of US dollar 200, 175, 150, 125 or 100 and a certificate of merit. An exhibition of winning entries will be held at the World Health Organization Regional Office for the Eastern Mediterranean in Cairo, Egypt. Dear parents, by agreeing for your child to participate in the World Health Organization art competition, you are giving consent that their artwork can be used by World Health Organization in any of its activities to promote health and can be displayed on World Health Organization websites, social media platforms, and in the final art gallery display of the winning entries. Here, have a look at the application form for World Health Organization art competition for school students. Here you can see the space to enter full name of the participant, their gender, male or female, tick the category under which they come according to their age. Then the citizenship, you have to mention the country of resident, which will be Bahrain. Then you have to give your home address, preferably in Bahrain, and the school name and address, that is Bangladesh School Bahrain, and its address will be shared with you by your class teachers. Include the home phone number and also the school phone number, including codes. You also have to mention the email address. Remember, you mention the email address of the student or the parent.